Hi, I'm Tammy Beilstein. Welcome to Tammy's Window on Calaveras. Today I have with me Laurel Jolliff, and she is our local Medicare expert. This woman knows everything about everything that has to do with Medicare. Totally true. Totally true. And I'm so glad that she's with us tonight because I know there are a lot of, I understand there's a lot of changes coming to Medicare. Now, because I'm not there yet, and because my memory is like a house plant, I have like nothing. It used to be that I could not remember the difference between Medicare, Medi-Cal, right, Social Security, all this stuff. It just all kind of is jumbled to me, and I don't know what I'm talking about. But tell us what Medicare is.
Okay, so until you're affected by it, you don't need to know it.
Yeah, thanks.
I mean, that's for the most part. So, I mean, I didn't know what a deductible was until I became an insurance agent, but I paid it every month. So Medicare is for people who are over 65, and it helps with their health insurance, or for people under 65 that have Social Security disability.
Okay.
And so Medicare is Medicare A and B, Part A and Part B. Part A covers hospitals and a few other things, and Part B is doctors and a few other things, and it covers 80%.
Okay.
So what I do is I help people with the Part D, the alphabets. This is the Part D, which is a prescription plan.
What's the C?
The C is a Medicare Advantage plan. I'm so glad you asked about that because that was a perfect
segue.
Letter. We did, on purpose. So A and B is doctors and hospitals, and Medicare covers that 80%, and then there's a Part D, the drug plan. The drug plan, by the way, is a voluntary plan that you're penalized if you don't have.
That's so dumb. Oh, I remember that now. That is so dumb.
Voluntary plan that you're penalized if you don't have.
That's horrible.
I know. So I help people with that because there are 30 different plans to choose from.
No.
Yeah. And
under D, there's 30?
Part D, yeah.
Oh, God.
And for the standalone prescription drug plan. And so what I do and what I recommend anybody do and everybody to do it, the pharmacies do it, is if you want to know what plan is the best for you, then I recommend you go to Medicare.gov and you put in your zip code and your prescriptions. And of the 30, it says what the best one is for you financially.
Oh, well, that's nice.
I also have a YouTube video that shows that whole process of how to do that. But I also do it for hundreds of people. And so,
can somebody have, if you rarely go to the hospital, they haven't been in years and years, can you get just the plan for doctors?
The A and B? Yes, you can.
You can just the B? Was it B for doctors?
Well, A you get automatically.
Oh, you do?
Free.
Okay.
And B, for people that just became Medicare eligible this year, it's $134. Next year, it's $135.50. Yeah.
Oh my God! Right when your income is stopping,
right. But then you need the D because A, you need drugs. You need prescriptions, most of them, but more importantly, you're going to get a penalty if you don't get it. And so we can talk about that penalty in a little while. But C. It's called a Medicare Advantage plan. And so people sometimes get a Part C to help supplement the costs that the Medicare doesn't cover, so that other 20%. Okay?
Is it worth it for most people?
Well, for some. So a Part C, they're called Medicare Advantage. They're usually HMOs or PPOs. But all Medicare Advantage plans, or Part C, are county-driven. Okay. So it depends on what county you live in. That determines which part of Medicare Advantage plans are available to you.
Oh, my goodness.
Okay? And so Calaveras has had one for many years. It's called United Healthcare Private Fee-for-Service Medicare Direct. That plan is going away December 31st.
Oh,
that's
what's in its place?
That's a big deal. Nothing. So there's 300 or 400 people in Calaveras County that have that plan who are losing it December 31st.
Do they get a lot of advance warning?
They have gotten letters the beginning of October. It wasn't that far in advance. And so these people are the ones that I'm trying to reach. And so that's one reason why I'm here to share that information. They are getting letters, but some of them are panicking and doing, their anxiety levels going up, and we don't want that. there are definitely solutions for them, but they don't know them.
Well, what
And
the heck are they
so-
supposed to do then?
So it would be terrific if they called me or an agent that they trusted.
Yeah.
HICAP, the Advocacy Center for the Seniors here in San Andreas, will help them also, but I know they're pretty booked up appointment-wise.
Okay.
Or they can do a lot of reading on Medicare.gov. And so what I do when I sit down with them, I explain all of it and how it's going to work and what all of their choices are, and then they decide what they want to do. And so I'm a salesperson, a sales agent, but I don't sell anything. I don't work for Medicare. I am an independent broker, which means AARP pays me, Anthem Blue Cross pays me, Blue Shield, Health Net, IAC, Humana, they all pay me. And so that's how I get paid. So I never charge for my services. So I'll go to someone's home and lay it all out and say, these are what your options are. What is your need? What do your needs look like? What does your pocketbook look like in order to, pay for those things?
So question, these places that pay you, do they all pay you the same amount?
No, they're all.
But you would never direct somebody to one where you're going to get paid more.
No, the Part D, it's by law. They all pay me the same.
Okay.
So it doesn't matter.
Okay.
The supplements that's now supplemental to Medicare, they're generally the same pay, but what matters. But I don't even contract with the companies that are more expensive because they're more expensive. I want what's best for these people. I don't. I want them to get the same thing for the least amount of money.
Yeah.
And
by
so
the way,
that's what
I
I
would
do.
totally trust you, but I know you. But I know these people watching don't, and I know that you would not gouge anybody.
No. I mean, if, for example, because United Healthcare is the one canceling the plan, United Healthcare is really trying to get these people to call in and get a United Healthcare supplement.
Right.
And sometimes that's the best price for them, but not always. But when they call United Healthcare is only going to tell them United Healthcare prices. They're not going to tell them what Health Net's prices are, for example.
Sure.
And so what's the benefit of working with a broker is I will show them United Healthcare's price, / AARP, Anthem Blue Cross, Health Net, Blue Shield, all of them.
Right.
Because they all pay me.
And if somebody's totally overwhelmed, you will help direct them to the right one, even though you're saying that you won't choose it for them.
Well,
they choose, but you can help
I
direct.
say these are what's available. This is the difference between the F and the G and the N, because those are all different plans. And so we go over all the differences, and they decide.
Okay.
So, and it's real easy for them to decide once they understand the differences between the plans, and then the different prices between the companies. So, for example, the F is the best plan they can get. It's the most comprehensive plan, I should say. It covers everything that Medicare doesn't cover.
Okay.
So, if you have an F, that's 100% coverage.
Okay.
So never have to pay a copay.
Nice.
You can have a triple bypass and you don't pay anything.
Wow.
3 MRI, you don't pay anything.
But imagine that is super expensive.
But the F is the most expensive.
Yeah.
And so, but the difference between AARP's F and Health Net's F is the price. That's it. Same with Blue Shield and the Anthem Blue Cross.
Okay.
It's a price.
Okay.
Because the government, the Medicare government, tells the companies what an F is, and what a G is, and what an N is.
Okay.
And so on page 70 of this year's book, this next year's book, it shows all of the list of the plans, and what's different about them. It's not as easy to understand, but it's there, and so I help kind of interpret that.
I wonder why it changes so often. Who does that?
Well, the Medicare Advantage plans can change every year. That's one of the cons about them, but you're paying very little for it. And so people pay $60 a month this year, knowing that there could be adjustments every year.
I would not like that. I like knowing what is coming.
Right. And so the supplement would probably be a little more easy on your heart and your stress level.
And then those don't change as often?
They don't change, but there's a big change coming up. On January 1st of 2020, the F is going away. But that's another year. We can worry about that later. But if you have an opportunity, if these people can pay for an F, then it might be a good idea to get it now because they can get it, and if they do, they're grandfathered in.
Oh, they are.
When the F goes away.
Oh,
Yeah.
that's huge.
Another big deal is if someone is ill
Yeah.
on the Medicare Advantage plan, it's going away. Well, now they can get that F supplement without any underwriting. It's guaranteed.
What is underwriting?
Underwriting, if you were 67 and you decided I want a supplement, you can call up the company and say, okay, I want a plan F. And they'll say, okay, great. What's your health like? Have you had surgery in the last 2 years? Have you been hospitalized? What kind of medication are you taking? And they can decide whether or not to take you.
Oh,
That's underwriting.
okay.
Okay.
So when someone turns 65, it does matter what your health
Well,
is
when they're
you're
turning
going to-
65, they have a guaranteed
Okay.
issue time, just a few months right
Okay.
after they turn 65. That's guaranteed.
Okay.
And then when they lose their plan, they're guaranteed.
Okay.
So if someone is ill and they really needed that supplement because now they're going to the doctor a whole lot or they're having
Yeah.
lots of surgeries or lots of physical therapy, but they can't afford it, or not that they can't afford it, but they couldn't qualify, now they will.
Okay.
That's a big deal.
And the age, the date, is it January 1st? Is that, it goes by the calendar
It's a
year?
calendar
So people who are
year.
65 by January 1st, right, are the ones that will be wanting to talk with you and sign up for these things. Is that how that works?
Yes. Once someone, when I meet a 60-year-old and they're asking me a zillion questions, I laugh and say, it's all going to change by the
Yeah.
time you're 65.
Right.
So call me when you're 64 and a half.
Okay. Okay, so they
And
want to
I'll
call
tell
you.
you what to expect, how many phone calls you're going to get, how much mail you're going to get,
Oh.
and what to do with them, and when we're going to meet, and all that. And so that's an easy thing for someone just turning 65. But
Okay.
10,000 people a day are turning 65.
Really?
Crazy.
Yeah.
Anyway, so
That's crazy.
So that person is easy. It doesn't matter about their health.
Okay.
They'll be guaranteed any plan they want.
Okay.
And so the people that had the Medicare Advantage plan here in Calaveras had that option, and they chose the Medicare Advantage plan. And it's for most people, they love the plan and are not happy that it's leaving.
Right.
But the good news is they can now go to any doctor they want. As long as the doctor takes Medicare, they take them. That's a
Okay.
big deal.
Do our doctors around here?
Most of
Most
them
of
do.
them take that?
Yeah.
Okay.
Some of them don't, but most of them do. And so they can go to any doctor, and if they get that F plan, they'll never have a copay.
Okay.
I just helped a gal today. She's going to be thrilled because her doctor wants her to have physical therapy. And the Medicare Advantage plan that she has this year is it's $50 every time she goes because it's a specialist visit.
Okay.
And so she's been putting it off.
Oh.
She can't wait till January 1st.
Oh, good.
Because now she has an F
Okay.
going forward, and she can go to the physical therapy as many times as she needs, and she
Good for
never
her.
has to look at her checkbook.
Okay.
And she'll say, okay, well, after the third Wednesday of the month, when she gets
Yeah.
her check, she doesn't have to do that anymore.
Oh, nice.
And so
That's
she's
good.
relieved.
That's
It
good.
was hard for her financially, but she saw very quickly the advantage.
Yeah.
And
Oh
so-
my gosh. So, it just makes my head.
Yeah.
I'm thinking
it's
about
crazy.
the people who. So, a lot of these changes are beginning January 1st.
Yeah.
Okay, but people need to be all set up to go before
Yeah. So
January 1st.
So as far as deadlines go,
So that's why you're here at the end of
Honey, yeah.
October. to
Yeah,
get-
yeah. So as far as deadlines go, the letters themselves. Well, first of all, we're in an annual election period right now. Between October 15th and December 7th, all Medicare recipients can change their drug plan anytime during that period.
Okay, tell me those dates again.
October 15th through December 7th.
Okay.
It's about a 7-week period.
Okay.
And so they can change their drug plan, and the changes will start January 1st.
Okay.
So, for example, if someone has a Humana plan and a doctor's been prescribing them something that Humana doesn't cover or it's real expensive, then they call me and we sit down and we go through Medicare.gov, and then let's say it's a WellCare plan that is the best one for them next year. And so I help them transition over to WellCare starting January 1st.
Okay.
And then January 1st they'll get that new plan with the new pricing.
Okay.
And so, but people know that those change every year. So October 15th through December 7th is a normal annual election period dates. The people that are losing their plan have 60 days after that, which means February 28th.
And what if they don't do anything? What if they see these letters coming and they just throw them away?
So, and a lot of people are doing that. If they don't do anything, then they'll only have Medicare A and Part B.
Okay.
Okay. United Healthcare, I read a letter today saying that they'll sign them up for an AARP Saver plan, which is $33 a month, which is twice as much as the least expensive one, which they probably need.
Oh, really?
Yeah. And so if you're not going to do it, then we're going to do it for you for the prescription part.
Okay.
But if they don't have a supplement, then Part A has a huge deductible, and it's about $1,230 per period.
Oh.
And so people say, well, what's a period? It doesn't say in the book. I know, that's silly.
Then what good's the book?
And this one, I will tell you, this one is not as easy to read as the years prior.
I remember seeing the ones in the years prior, and I could not
this one's
understand those for anything.
This one's not as friendly. But a period for Part A deductible is, because A is hospitals, if you're in the hospital, when you leave the hospital, 60 days from then, that's what that $1,230 is good for. If you go back to the hospital a couple months later, you pay that $1,230 again.
Oh my gosh!
And so I basically I say it more simply that says, and I say it's about quarterly.
Okay.
So if you went to the hospital in January, you'd pay $1,250. If you went back in April, you pay it again. You'd go back in July, you'd pay it again, and you go back in December, you pay it again.
Oh, holy smokes!
And so, not having something that pays that Part A deductible like a supplement is huge.
Yeah. Oh my gosh!
And then
I had
the
no
Part
idea
B deductible is $185.50 next year, and that's for doctors. Okay. And so it's an annual deductible. So.
That's an annual one.
It's an annual deductible. So bottom line is, it could be expensive to only have A and B.
Sure.
Also, after you pay that Part B deductible, you're responsible for 20% of all the bills for doctors.
Wow. Okay.
And durable medical equipment is also part of Part B. So it's very expensive to not to do something.
Right.
And so.
Do most people take care of this and get everything under control, or do most people throw those letters away and not do anything at all?
Both. It's both. I would say 99% of them panic.
Yeah, that would be me.
Because I don't understand. Because they don't understand.
Right.
I went to Italy and I didn't know the language, and boy, was I uncomfortable.
Yeah, and it seems so confusing. It's like, I don't even want to begin. I wouldn't even know where to begin.
They put it off and put it under the table like you don't see it. But
I throw it away. It goes away. I don't have to look at it.
And more importantly, deadlines are real.
Yeah.
So.
Okay. That's crazy.
So you were asking about the Part D penalty.
That makes no sense to me.
I know. It's a voluntary plan that you're penalized if you don't have.
Who comes up with that wording? Government?
I would call it federal government. So that penalty. You'll laugh when I say it, and then I'll explain it. The penalty is 1% of the national average times the number of months you didn't have it but could have. That's how it's said. So what that means in English is, so the national average of a drug plan is $31 this year. And so that means if you take 1% of that, it's 31 cents. And if you multiply 31 cents times the number of months you could have had it, like let's say that I could have started my Medicare January 1st of 2018, and I decided not to get a drug plan because I'm healthy. I don't take any prescriptions.
Yeah.
Why would I get one?
Right.
A lot of people say that. And so they went all year without a drug plan.
Yeah.
Okay, so that's 12 months. And then they say, okay, fine, I didn't know about the penalty, sign me up. And so then we signed them up for 2019. Mm-hmm. Well, because they went 12 months without a drug plan, that 31 cents times 12 is about $3.72 a month. That they're going to pay more for their drug plan, $3.72 more per month for the rest of their life.
That's
Crazy.
harsh.
Yeah, it is.
That's a harsh punishment.
It is.
Wow.
Especially for the 65-year-old.
Yeah.
Not so much for the 90-year-old.
Right.
You know?
Oh, my God.
I mean, those are like $30 a month penalties. not $3.
We went to the federal government. Is it true that Republicans are trying to take away Medicare and Social Security and all of that? Do you know? I see that. I am Republican. I see that on Facebook, and
I don't believe that it's a Republican thing.
Okay.
It's a thing. They are, not they Republican, but they, Congress, is talking about doing a single payer system. And so what that means is everybody would have the same plan. So if Medicare went away, it would just be called something else because everybody would have it.
Okay.
And
do you think it would cost the same for everyone and they'd all get the same service?
No,
It would
well,
probably
put
go
it
by
this
your
way.
income?
So let's change pages for a second and talk about Covered California with that in
Okay.
mind. So Covered California is under the Affordable Care Act, and every year fewer, this is not statistic that you'll read. It's,
Okay.
If you read stats, they say different than what I believe to be true.
Okay.
Because they look at the positives and they word it in such a way that it looks
Sure.
one way but really is the other.
Right.
And so I believe that numbers have fallen each year
Numbers of what?
of people who have who have taken Covered California.
Okay.
And so because of that, fewer people are paying into it, which means less money's going into it to pay for those who aren't paying much at all
Right.
for it.
Right.
And so now fewer people have gone into it, which means it's going up in price to take care of the difference.
Right.
Does that make sense?
Yeah.
And so now there's even less. In 19, the penalty goes away for not having Covered California.
Oh, okay.
So if you in 2019, if you don't have a health plan, if you're under 65, you're not going to be penalized for not having it.
Oh, all right.
Okay. You'll pay all your bills. I mean, I should say you're going to pay the whole hospital bill if you go to the hospital.
Right, okay.
You know, and if you don't qualify for Medi-Cal, you're going to pay it one way or the other.
Yeah.
And that's scary. But because it's not required, a lot of people are going to drop off.
Yeah.
And so
Sure.
because of that, the premiums for those who remain are going to go way up.
Oh, my goodness.
Now, that is not what, the big companies are going to say, or even Covered California, because I believe, I don't want to get in trouble here, but I don't believe that numbers are, they kind of skew it, like I said.
Yeah.
I don't think numbers are going up.
Okay.
They say more are going into the system, but there are many who are in the system that shouldn't be.
Huh.
It's very confusing.
Oh, my gosh.
Yeah. I'd put you to sleep.
What do you see for the future of this with the changes? And
My crystal ball.
you've been doing this a long time. You're such
I have.
a pro.
I've been doing
Yeah.
it for 10 years. Yeah.
Awesome.
Yeah, and I love it. I love the Medicare part of it.
You know that's weird, right? It's so weird to me when you say that you like this.
You know why I like it? Because there are so many seniors who say, I don't understand this.
Right.
And I'm able to help.
Yeah. I'm so glad that you do. Thank
But
goodness that
we
you
all
do.
want to be needed, and I'm
Yeah.
kind of needed by them.
Yeah.
And,
You always have a
and that's
brain. You have a
nice
brain
thing.
for numbers
I
and,
do.
and organization and
Yeah.
and all of that. Yeah.
I try, yeah.
You just
But I
do.
I do enjoy it though. I really do. I mean, more for the relationship. Today I had several appointments today, and I met some neat people that I hadn't known before.
Oh,
and I'm
cool.
just so excited. The men, we get along great, and the women are just
Yeah.
lovely.
Yeah.
And so I just meet really, really neat people.
Yeah. Well, you're so friendly. Who wouldn't like you?
Oh,
I mean,
thank you.
seriously. What would you like to see, if you were in charge of all of this, what would you like to see happen with Medicare? Or as far as taking care of the older generation, what do you think would be the best plan?
I don't believe Canada's got it right. I
No?
don't believe, no, because they wouldn't treat an 85-year-old. They would say, bye-bye, go
Yeah.
home.
Scary.
You know? I mean, I've got a 70-year-old girlfriend who's on kidney dialysis, so they would say,
Yeah. Hey, you're 70. You already
you're
lived.
70.
Yeah.
Right. And I don't think that's right at all.
No.
She's got a whole lot of life left in her.
No.
I think, I like the idea that the plans cover a lot, like the F plan. I'm not crazy about the cost of it. I think there should be some money moved around with Social Security that they could help them more.
Okay.
Yeah.
There was such a fear. Like I said earlier, on Facebook, I see my older friends. They try to be so on top of all of this because that's a fear. It's a huge part of their life and planning for what's to come.
Yeah.
How do you do that? I mean,
Well, you know, a gal called me a couple of days ago after your death talk. I don't remember which one it was.
Over the San Andreas Chapel. The
probably, yeah. And so she called me.
Before I Die Forum, that's what it was
Yeah,
called.
okay.
Yeah.
And so she called me and she said, okay, I've got a list of things to do. I've got to do
Oh.
this and this and this, and I need some life insurance.
Good.
And so she called me.
Oh, very
I
good.
was like, "Well,
I'm glad.
Yeah, I think I talked to her tomorrow.
Awesome. I'll have to pass it on to the guys over at the mortuary in Krista.
She says, I've got my homework. And I was really excited to hear.
Oh, good.
Because a lot of people don't think they need to get ready for that.
Yeah.
Yeah.
Oh, God, I do. I don't know if it's because I know you or what, but it is on my mind, and I am not looking forward to it.
Right. Yeah. It's hard. I can't imagine.
Yeah.
Doing things without it's got to be someone you trust. The other challenge is, I mean, even if you're with AARP, I mean, AARP are master marketers. That's what they do. And so these people are inundated with junk mail. And so among all that junk mail is, by the way, your plan's leaving.
Yeah.
You know, or here's your new Medicare card.
Yeah.
People say, I didn't get it. Well, it's probably in that junk mail pile.
Right.
Because they send so much. People don't answer their phone anymore because of telemarketers. Well, sometimes they need to because that's United Healthcare calling because they need a question answered.
Wow.
You know, and unfortunately we've done that to ourselves. You know, with the marketing craze that we've all been a part of.
Yeah. I hate those calls. I even send them to voicemail usually if I don't recognize the number because who wants to deal with that?
Yeah, well, with me, it's funny because they'll call me and leave a message. I'll call them back and they won't answer because they don't know the number. I was like, well, you just called me. I'm returning your call. But
So we have like 2 minutes left. Is there anything that you wanted to make sure that we touched on before you go? For one thing, I want to make sure people have your phone number and the best way to contact you because like I said, I trust Laurel so much. She is the person that I would go to and the person that I want my friends to go to.
Thank you.
So how can they reach you?
So the best way to reach me is on my office phone, which is 209-786-2021.
Okay.
And leave a message. So some people don't like to leave messages. Please leave a message. I will call you back. Talk to the pharmacy, talk to someone you trust, anyone that is an expert on this subject. You just need to, and most importantly, you have deadlines.
Awesome. Yeah, we are out of time. You, young lady, need to have your own show. You definitely do. You have so much to share, and I know that everyone learns so much when you're on here. It just goes by too quickly. You've got to have a show. Thank you for being here.
You're welcome. Thank you for having me.
Please give Laurel a call if you have any questions about any of this. She's the go-to girl. I want to thank you guys for watching, and I'll see you next time on Tammy's Window on Calaveras.